So, Hoda, when you wake up in the morning and say there's something that bothers you and you're a little tired of, the good news is there's so much we can do about it these days.
We can get something done?
I know a doctor who can help us.
Who is that?
I think it's Dr. Heidi Waldorf.
Yes.
So nice to see you.
Hi, Dr.
Thanks for
Waldorf.
having me.
And we're talking Botox, which is, it's become just such a normal part of life, isn't it?
It's been around forever, too.
It has, and we know it's safe, and it's medicine. Think of it just as a very safe medicine.
But isn't it also about the person that does the actual procedure, too? Because, I mean, it's an art form as well.
There is no question, and I always say to patients, it's not the paint or the paintbrush. It's the painter that makes a masterpiece.
Let's talk about fillers versus Botox. I don't know the difference, so which is the right one to get?
Very common. They are different.
Yeah.
Botox and Dysport and Xeomin, the other toxins, are relaxers. We use them to keep you from making movements that make wrinkles. We can also take away downward movement to make something go up, or take away upward movement to make something go down. And fillers fill or replace lost volume.
So they are worked in tandem.
Exactly. The people will say, which should I get? And I say it's like an outfit. Think of all the pieces that make an outfit. Maybe some Spanx, if you haven't had cool sculpting, Spanx, a skirt, a top, some jewelry, shoes. Together, they make an outfit.
You know what I feel like I'm noticing? I'm noticing more and more young people who I feel like in their 20s or 30s getting it, and I wonder, like, why?
They're avoiding the wrinkles to begin with, right?
Exactly. The way I think about it is preventive maintenance. Because if you wait and do nothing, then there's an awful lot you have to do to get to that tipping point of where you're going to feel good about yourself. But if you tweak things gradually, and the way to know it is look at your folks. I look like my dad. First time I did Botox, he said, why? I put him in front of a mirror and said,
that's why.
That's why.
Yeah. Somebody once said, I think it was Pat Wexler said, do as little as possible, as often as you possibly can.
Exactly.
So if you're in your 30s, give me a little, like, what should someone in their 30s do?
30s, first of all, besides sun protection and all the other topicals, be sure to look at your parents. If you are a squinter, that's a great time to start with some tox because you won't then grind in those wrinkles.
That'll be inevitable genetic.
Exactly.
What if you're in your 40s?
In your 40s, we start looking at playing catch-up for some of the things that were
we neglected in our 30s.
And you know what? They have photos here that we're supposed to be doing. I'm sorry about that.
That's okay.
Here, whoops, sorry.
Okay.
30s. So here we have 30s.
Gorgeous.
Now, just so you know, none of these women are patients. They are just, these are stock photos. So if you look here, look at the 30s. Do you see how she's starting to get little crow's feet? And if her mom had some lines, we could do this. The other area, tox for the neck, is great to keep from pulling. If you're someone who's starting to get these little lines, or some of us have had hollows under our eyes since we were babies, you can start just tweaking that, and that's really nice.
Let's go 40s.
Then, if you look first, this is just to show with Botox that frowning, that you can't frown after, but what it doesn't show is that at rest, she looks natural. She just isn't making those lines deeper and deeper. If you look here, this is 40s, catch-up.
Still beautiful.
She's beautiful. Oh, these women are all beautiful, and this is not about whether you're beautiful. This is about feeling confident and not feeling as tired as we all are as women and men. So if you look here, you see she's had a lot of sun damage. So there's more and more of that. A lot of women in their 40s, also with pregnancy, have had weight shifts. So we have to play catch-up. Maybe some tox and some filler. Again, in this area, tox and filler.
What fillers do you suggest? Because there are all kinds.
It depends on you, and there is no one filler that's best. If you want someone for bigger lifts, you might need something like Voluma or Restylane Lift or Radius. For pan volume, something like Sculptra. For superficial lines, we have other Restylane and other Juvederm.
Yeah, let's get in 50s because that's what everyone's waiting for. Here we go. This is the one we've been waiting for.
This is just showing another tox picture just to show different people. And 50s. So one of the big things with the 50s is that as women, we start losing bone at 25. So by the 50s, that's one of the reasons you're seeing this area. So we focus on that jawline, replenishing that. You also see these lines are hanging out. And you see how she's hollow in here? So some filler, a little filler, and again a little filler, and a little tox, a little tox.
Filler up.
That way, but notice that if you started earlier, you don't get to this point.
Right.
I mean,
Okay, we get it.
And I'm 52, and I've been doing this a long time.
Heidi, you look good.
Maintenance.
Dr. Heidi
Thank you
Waldorf,
so much.
by the way, is New Beauty Magazine's cosmetic dermatology partner. Thank you so much. We
Thank you
appreciate
very much.
it.
What works and what doesn't for getting rid of those unsightly veins? Right after this.